Hi, I'm Natalia Jablokov. I'm your host for Health and Wellness. I'm sitting with Sean McMillan at the Professional Orthopedics at Lourdes Health System. So tell us about yourself.
Natalia, thanks for having me. I'm the Chief of Orthopedics here at Lourdes Burlington campus. I've been with Lourdes for about 3 years, and I specialize in orthopedic sports medicine. So on my end, I treat mainly ACLs, rotator cuffs, as well as replacement of joints, particularly shoulder replacements. So speaking about joint replacements, I'll give you an example. So a shoulder replacement is something done basically in a one-day setting. So the patient will come to the hospital on, say, a Wednesday. They'll have the surgery done, which takes about an hour and a half to 2 hours, and then they'll stay overnight just for some pain control and to make sure that they're okay. The next day they'll typically go home and they'll spend about probably 6 weeks or so in a sling. But they'll be able to take their arm out of the sling to do some gentle range of motion and get the arm moving a little bit. At that point, when I see them back at the 6-week mark, we'll check them, make sure that they're doing well, take some x-rays to ensure that everything's in the right spot, which usually it is, and then from there we'll begin some physical therapy to get the strength and the motion back. I tell my patients usually about 3 months, they're about 80% themselves. So you're not perfect yet, but you're way better than what you were. You notice a great difference in your pain control and your motion and your strength, and from there you sort of round out over time. Generally, when you start talking about getting back to work, it's about a 3-month sort of recovery if you're in a manual sort of field. In a more sedentary sort of field where you're behind a desk, I've had people go back as soon as 2 weeks after surgery, or as long as 6 to 8 weeks, depending on what their needs are and the severity of the work that I performed on them.
So I'm guessing that that is also called driving.
Yeah. So driving. That's actually one of the big questions I get right away: is when can I drive again? And the honest answer is when you're out of the sling, because you need 2 hands to drive a car. So you're looking at about 4 to 6 weeks or so before you're driving with a shoulder replacement. Now, other surgeries like hip replacements and knee replacements typically will start driving about a month afterwards. Typically, when you're off a cane or a walker, we'll let you start driving again. But like anything else, it's a feeling out process. There's no one prescription that fits all. So I'll say to my patients, go to an empty parking lot and practice driving, see how you feel. If you had a good feel and you feel like you can go from gas to brake safely, go ahead and try it out. Go to the grocery store, go to the gas station, and progress on from there. You don't want to go a cross-country trip about a month out of surgery. It just doesn't work well.
So are these people evaluated before they get surgery done to make sure that they are healthy enough? Yeah,
so any patient that's entertaining the idea of a joint replacement, generally we go through a screening process, and we here at Lourdes Health Systems have a good sort of multi-practitioner approach where we're able to get you from our door to our primary care doctor's door to make sure that your heart and lungs check out appropriately. We can order the EKGs or the lung tests that may need to be done or may not need to be done. And once we know that you're medically safe to undergo the procedure, then we take over and we'll do our surgery. But all along the way, we have you following with those providers post-surgery to make sure that your blood thinning numbers are okay if you get put on a blood thinner post-surgery, to make sure that if you're a diabetic, your blood sugars are maintained, because surgery can sometimes affect your blood sugars post-operatively. We want to make sure that we keep you hand in hand along the way, so that way we don't drop the ball. And that's one of the nice things about being part of the Lourdes Health System, is we have the ability to sort of meet everyone's needs, no matter what they may be.
So basically it all depends on their health, so it doesn't matter what age you are. You can definitely get this at any age.
Correct. So, that said, our younger patients in general that aren't, when you talk about joint replacements, in general, you're talking about more of an older subset of patients. There is the outliers that are of a younger age that may have had a traumatic injury that are getting replaced, but by and large, we're dealing with an older subset. And for the most part, anyone over the age of 40 goes through a standard evaluation for surgery. They'll get blood work. They'll get an EKG, a chest x-ray, and if anything sticks out that's abnormal, then we'll progress on there to either cardiology or nephrology, whatever it may be, to make sure that we don't put you in harm's way. And there are plenty of instances that I can give you where we've actually found an underlying disorder that may not have come up if they weren't going in for their joint replacement. So we're able to sort of get their overall health and wellness, back in shape besides replacing their knee or their hip.
Very interesting. Is there anything else you want to tell the viewers?
Yeah, so, the big fear is, there's a psychological component to replacing a joint. Everyone remembers they were born with, 2 shoulders, 2 knees, 2 hips, and it's tough to let go of that. But that said, we tend to look at our patients and we say, when you start giving up the things that you enjoy in life, you don't want to go to the mall anymore, you don't want to bend down to pick up your grandkids, those are the times that you really start to weigh, the pros and cons of getting the surgery done. There's no magical age for when to get a replacement done. I've had lots of patients tell me, you know, well, I don't want to have to worry about getting it revised or having the surgery redone, you know, 20 years from now. And what I say is, why do you want to burn good years of your life now, not enjoying what you like, because you're worried about something 20, 25 years from now? The honest answer is we don't know 100% how long these joint replacements will last, if it's 20 years, 25, 30 years. But I want you to live your life now and enjoy it, and then we'll worry about that down the road. Because technology is getting better, and very honestly, you know, we have this ability to make your life better now. Let's use it, and that's where we go with it.
So you're letting these patients know that when you get the joint replacement now, who knows what's going to happen in a couple years. Like, you may need surgery again, you may not, but let's just not worry about that right now.
Yeah, my partners and I by no means take the replacement lightly. We actually tailor our approach to our patients very individualized. We talk about, you know, the different types of replacements that are available. For instance, in the hip, we can talk about whether you want to use a metal component with a plastic sort of cup, or if you want to use a different component like ceramic, and each one of those is tailored to the individual given their age, their functional demands, and what they're looking to get out of it. So we don't just, you know, take the, you know, A off the shelf and give it to B every time. We sort of match it up there. And that's what's really unique about healthcare now, is we have options. So no longer are we sort of stuck in that pigeonhole of we have to do this the same way every time. We can sort of make it individualized, and that's really given us better results for our patients and a better quality of life. We've had soldiers go back and deploy after getting joints replaced. We've had, you know, policemen go back to, you know, fighting crime, and it really is something that's unique and special, and it's nice to be able to give them back a quality of life.
Absolutely. Well, thank you so much, Sean.
Listen, I appreciate your time.
Thank you.
Yeah, thanks.